Assalamualaikum. I am Dr. Abid Hasan, lecturer Department of Pathology, Bashundhara Ad-din Medical College. Today I am going to discuss about cellular injury and adaptation. At first we should know how to cellular injury occurs. Cellular injury when normal cell exposed to injurious stimuli or stress, at first it start to adaptation. If it unable to adapt, then cellular injury occurs. Cellular injury has two types: reversible cell injury and irreversible cell injury. Irreversible cell injury occurs by necrosis and apoptosis. And now I am going to discuss about the definition of cellular adaptation. It is the most frequently asking question in Viva exam. Adaptations are reversible changes in the size, number, phenotype, metabolic activity or functions of cells in response to changes in their environments. Types of cellular adaptations. It has four types: hypertrophy, hyperplasia, atrophy and metaplasia. Hypertrophy, it refers to an increase in the size of cells that results in increase in the size of the affected organs. Hypertrophy may be classified as two types: physiological hypertrophy and pathological hypertrophy. Physiological hypertrophy occurs by exercise, such as during exercise biceps hypertrophy, triceps hypertrophy and pregnant uterus. And pathological hypertrophy occurs in case of prolonged uncontrolled hypertension. Left ventricular hypertrophy occurs. Hypertrophy may be occurs by increase in functional demand and stimulation by hormones or growth factors. Hyperplasia, an increase in the number of cells in an organ or tissue in response to stimulus, is called hyperplasia. Hyperplasia may be two types: physiological and pathological. Physiological hyperplasia occurs by hormonal and compensatory. Hormonal hyperplasia occurs in case of puberty in breast and uterus during pregnancy. Compensatory hyperplasia occurs by partial hepatectomy and unilateral nephrectomy. Pathological hyperplasia: endometrial hyperplasia, benign enlargement of prostate, hyperplasia due to viral infections, atypical ductal hyperplasia of breast. Hyperplasia is the fertile soil for cancerous proliferation. Hyperplasia is the result of growth factor driven proliferation of mature cells by increased output of new cells from tissue stem cells. In case of hepatectomy, the growth factor is activated more rapidly and the hyperplasia occurs. Now I am going to discuss about atrophy. It is the most frequently asking question in Viva and most important topic for our written exam. Atrophy is a reduction in the size of an organ or tissue due to decrease in cell size and numbers. There are many causes present for atrophy, such as important causes are common cause decreased workload, loss of innervation, diminished blood supply and inadequate nutrition. Mechanism of atrophy. How atrophy occurs? Atrophy occurred by decreased protein synthesis and increased protein breakdown. There are several mechanisms for decreased protein synthesis and increased protein breakdowns. Now I am discussing about most important topic such as metaplasia. Metaplasia is a reversible changes in which undifferentiated cell type is replaced by another cell types. Types of metaplasia: epithelial metaplasia and connective tissue metaplasia. Epithelial metaplasia is squamous metaplasia and columnar metaplasia. In case of chronic smoker patient, the lungs squamous metaplasia occurs where pseudostratified ciliated columnar epithelium is replaced by squamous epithelium. And in case of Barrett esophagus, columnar metaplasia occurs where esophageal squamous epithelium replaced by columnar epithelium. Connective tissue metaplasia occurs in case of myositis ossificans. Metaplasia is a double-edged sword. How it occurs? Due to it causes alteration of normal physiological functions, such as in case of lungs, squamous metaplasia occurs, normal secretion of the lungs is altered, and pathology, and it may be a fertile soil for a malignant transformation. So that's why it's called double-edged sword. Thank you all for your patience. In next class I will discuss about how to cell injury occurs and discuss briefly about cell injury. Thank you.